Greetings, my name is Bob Hindle and I'm with Neighbors for Life, and I thank you for coming to our website www.neighborsforlife.org. Portability. Here's the nightmare scenario. Person is struggling with some kind of illness and they lose their job. They were covered under their job, but the moment they lose their job, they also lose their insurance. This has to be addressed. We have to have employment independent insurance. We have to have the possibility of a person continuing their health coverage plan after the time of either termination or being laid off from their employment. What's another reasonable proposal that's been made? Tort reform. Tort reform. What does that mean? Sorry, I'm sort of fiddling with these papers, but we'll get this going for you. Here we go. Tort reform. Now, tort reform would mean that in the instance of malpractice suits, and malpractice suits incidentally do have validity. Right? I lived in Germany and there was a hospital that was noted for if someone had to have, say, their leg operated on, they would go in and they would have the appendix removed. So there was a lot of bungling going on. And in those instances, malpractice suits are meritorious. But there are many malpractice suits that are brought strictly for the enrichment of the trial lawyers. And this is a real problem in the United States, and it's a problem especially because doctors now have to carry all this enormous malpractice coverage, and they have to do tests, all of which drive up the costs. And guess who pays for the additional costs when there are more costs in the healthcare system? Well, you got the right answer. Okay, the last one that has been put forward, and this is one that has been put forward for decades now, but not really effectively acted upon. And this is Medicare and Medicaid reform. These are programs that are at their inception were very good. They were intent on covering the elderly, they were intent on covering the low-income population and giving them basic health care and other basic benefits. However, what has happened over time, and most of us are very well aware of this, is the demographics of our country have changed. There are more elderly people and far fewer younger people to labor and pay for the benefits that the elderly and the entitlement programs are receiving. One of the sad circumstances of this is due to the 50 million children who have been killed in abortions. And this is something that we really need to think about, even if we wholeheartedly are not against abortion on a moral level. There's a social cost of it as well. Medicare and Medicaid reform would require really looking carefully at what we can as a society sustain in terms of our entitlements and what we have to shift. And again, I'm not an expert on it. It might be the subject of a future presentation. However, once again, here are some real practical suggestions of how to decrease costs and how to increase access. Guaranteed access, mandated by law for insurers, competition across state lines, portability, so that insurance is employment independent, tort reform, and Medicaid and Medicare reform. Okay. What is the current legislation about? Does it include these kinds of points? Well, unfortunately not. What are we dealing with in the legislation that today is being rushed through the Senate and the House? Well, for the sake of this presentation, I'm going to call it Obamacare. Now, I want you all to understand, this is not meant in a derisive way. Some people think, well, you're deriding President Obama by saying that. That is not at all what I'm saying. Obamacare simply because the actual terms for the bills, the House bill is H.R. 3200, and the Senate bill is the bill for patient care and affordability. It's kind of a mouthful. It's easier to say Obamacare, and after all, this is the centerpiece of the Obama administration,
He is wholeheartedly behind this every step of the way, and he's waiting with bated breath to sign this into law. So I think rightly we can call it that. All right, what are the tenets of Obamacare? Let's kind of, I mean, 2,000 pages in the House, 2,500 pages in the Senate. I think War and Peace is like 1,000 pages long. It seems to me that the Senate and the House people are very, very skilled readers. In this period of maybe a few days, they've read 2 novels. They understand its contents absolutely with confidence, and they voted for it. The House Democrats and the House and the Senate Democrats, they should be commended for their astute and absolute great intelligence in absorbing all this material. But for the rest of us, for average citizens, I would suggest we need to have a little bit of an overview of what's contained in these bills. The first basic premise of this legislation is this: healthcare is expensive and access is bad because, and this is the main reason, because the private sector has badly, badly screwed it up. We all, remember what happened prior to the election, Wall Street collapsing and all these greedy bankers. Of course, whose fault was it? It was the bank's fault. It was the mortgage company's fault. It had nothing to do with government. It had nothing to do with the citizens who were picking up mortgages that were beyond their means. No, it was the private sector, these greedy bankers. And for the same reason, healthcare is a disaster. These greedy insurance companies, these greedy pharmaceuticals, these greedy doctors who are overcharging, these greedy hospitals who are overbooking and overcharging. Therefore, solution, government. Government intervenes, takes over, and lots of things are going to get better. So, government involvement. Government involvement, what does that mean? It means that, for instance, when a hospital readmits someone, well, obviously they screwed up the first time around, so that hospital should be fined. It means that doctors who are taking all these big bucks for Medicare should be paid less. Let's just cut their rates. It means that patients who don't really know what the proper care is for them, especially if they're elderly, should be advised. We should set up many committees and consultations. It means that families who are struggling because they're low income should be given consultation, family planning. Government will be the solution to all this. Second point, mandatory insurance. Mandatory insurance. This basically means that every citizen will be now mandated to get health care insurance. This could happen one of 2 ways. Either A, it's going to be through their employer, who in turn will be mandated to get insurance for their employees. Businesses exceeding revenues of $250,000, if they don't provide insurance for their employees, will be fined substantially. And individuals who don't get insurance for themselves will pay a fine of $750. Okay, so that looks like, hey, we're moving in the right direction here. We're getting more access. Obama is promising to cover 30 to 40 million new people in this manner. Just move them right in with a mandate. That was tried in Massachusetts, by the way. Didn't quite work. A lot of people opted not to get the insurance and paid a fine. But that was under Mitt Romney, and that's probably why it didn't work. So I think that, mandatory insurance and a mandate, who knows, maybe that has some potential. Let's look at some of the other premises of the bill. Another premise is Medicare cuts. Medicare